I would like everybody to imagine that they have an 18-year-old daughter that went to an outpatient surgery center for an elective cosmetic procedure, had a reaction to the general anesthesia, and died. Research suggests that mortality rate of malignant hyperthermia decreases because of early detection and precise coordinated treatment. Knowing what malignant hyperthermia is and early detection decreases that mortality rate. The only treatment for malignant hyperthermia requires precise and coordinated care. As Rosenberg and colleagues in 2015 suggest, malignant hyperthermia is a pharmacogenetic disorder that is a hypermetabolic response to volatile agents such as halothane, desoflurane, isoflurane, and sevoflurane, and the depolarizing muscle relaxant succinylcholine. Malignant hyperthermia is a life-threatening code blue situation. As stated by Rosenberg and colleagues in 2015, the classic signs of malignant hyperthermia are increase in temperature, 1 to 2 degrees Celsius every 5 minutes, tachycardia, tachypnea, increase in CO2, increase in oxygen consumption, acidosis, hyperkalemia, muscle rigidity, rhabdomyolysis, and hypermetabolic response. As stated by the Malignant Hyperthermia Association of the United States, the most consistent indicator of potential malignant hyperthermia is the increase in the end-tidal CO2 with a minute of positive pressure ventilation. Malignant hyperthermia must be screened preoperatively, and every patient should be monitored during and up to 1 hour post-anesthesia. As Seifert and colleagues in 2014 suggest, untreated malignant hyperthermia produces cardiac arrest, kidney and liver failure, abnormal blood gases, internal hemorrhage, cardiovascular collapse, and death. From the website of Stephanie Judah-Kubla for the awareness of malignant hyperthermia, you can see the picture from her website. This is a young girl that went to that surgery center. They did not have the only treatment of dantrolene for the syndrome, and she did die. If MH is treated timely with the only treatment of dantrolene, it stops the metabolic trigger by that volatile agent. The mortality rate of malignant hyperthermia has decreased over the years due to enhanced preparation, early detection, and knowledge of the treatment. Seifert and colleagues in 2014 states the goal of treatment in malignant hyperthermia crisis is to arrest the abnormal metabolic process with dantrolene and return the patient to normal temperatures and hemodynamic conditions and the metabolic functions. The primary treatment for malignant hyperthermia is number 1, to stop the volatile agent, color code blue, and hyperventilate the patient with 100% oxygen. As stated by Rosenberg and colleagues in 2015, prepare and administer the dantrolene 2.5 milligrams per kilogram for the initial dose and repeat the doses every 10 to 15 minutes until the symptoms of the syndrome have subsided. Also treat the underlying symptoms such as cooling the patient by routes such as a large bore IVs, cold fluids, and irrigating of the open wounds, bladder, stomach with the cold salines. Wrap the patient in cooling blankets and pack the patient in external ice packs. As stated by Rosenberg and colleagues in 2015, cooling measures should stop when the temperatures are below 38.5 degrees Celsius. Treatment of side effects such as arrhythmias, temperatures, and coagulation irregularities such as blood gases and electrolytes and the creatinine kinase should take place at that time. The secondary treatments after stabilization, you need to continue the dantrolene drip 1 milligram per kilogram every 4 to 8 hours for 24 to 48 hours, per Rosenberg and colleagues in 2015, and continue with the secondary treatments. At any time during the crisis, you can contact the MH hotline at 1-800-644-9737, and they can guide you through the crisis. In conclusion, research suggests that mortality rate of malignant hyperthermia decreases because of early detection and precise coordinated care. Being educated in malignant hyperthermia and having the ability to recognize the signs and symptoms helps you gain the understanding of the importance of early treatment. Early treatment of malignant hyperthermia and preparedness for the crisis event can and will decrease the mortality rate of your patients. I urge all of you to research and educate yourself further on malignant hyperthermia and complete simulation exercises that include members of your team so that you are comfortable with the diagnosis and quick action to treat this crisis to save the lives of the patients that you take care of.